Did you know most of your employees do not understand Medicare? In fact, they actually confuse Medicare and Medicaid in most cases.
It's true. It happens all the time. We are Shannon and Michael. We're with Healthcare Genius, and we're here today to talk to you about what exactly it is that your employees don't understand about Medicare and how you can help them understand and get prepared.
In this video, we're going to talk about employers that have 20 employees or less in their organization. You'll understand the distinction if you watch our next video, which we'll talk about with employers with 20 or more employees. But the first thing is that when your employees turn 65, you're really required to sign up for Medicare Part A and B if you work for a company with less than 20 employees. So what does that mean? It means that you'll have to go down to the Social Security office or do it online and registered, and then you're going to get a Medicare card that will have Parts A and B on it, and you'll have an effective date of the first of the month when you turn 65.
Now, if one of your employees does this, can they still stay on your group health care or on your group health plan?
They can, but they still have to end up starting to pay the Part B premiums for Medicare. If they're not yet taking Social Security, then Medicare is going to send them a quarterly bill for those premiums. And then depending on what their income is, they may pay some additional costs for Part D as well as Part B if they're in a higher income bracket and they're continuing to work. So yes, they can then stay on your employer plan and use that coverage as supplemental coverage to their Part A and B.
Okay, so one of the things that I heard you mention actually leads us into the second part that your employees don't understand, and that's what's known as Medicare means testing. And this is a huge issue with people because they don't understand that the more money they make, the more they will have to pay for Parts B and Parts D. And so for your employees who at 65 have to enroll in Medicare, they're paying that Part B whether they like it or not. And it might not just be the $136 a month. If they make more than $87,000 per year, it's going to be more per month. And that's something that comes straight out of your Social Security check, so you don't have a choice.
Right. Or as we said, you'll actually end up writing the check for it. What a lot of people don't understand is that when they're working for an employer, the share of healthcare premiums that they pay, in most cases, they don't have to pay tax on. So it basically means that they save federal, state, and FICA or Social Security tax. So they're not having to pay that when they're still working. However, once they go on to Medicare Part A and B, those premiums that they're paying are no longer tax deductible or tax free.
Plus, they don't have you to help them out with their premium payments.
That's right. Exactly. Once you've signed up for Part A or B, you no longer qualify to make contributions to an HSA. So we've had employers who make contributions and they can no longer do that once the employee is on Medicare.
Yep. And the last piece that we want to talk to you about that your employees don't understand may be an obvious one to you, but it is a real problem. People don't understand what Parts A and B are, and sometimes they really don't know what the difference between Medicare supplement plans are, Medicare Advantage plans. And so it's a hard thing to help navigate your employees through, but we really want to encourage you to help them out with these things, give them the education they need, and not just do it 3 months before they turn 65.
Great point, Shannon. And one of the things we've done is we've created a playlist on our YouTube channel that actually goes through all the components of Medicare, so that you and your employees can be educated about A, B, C, D. You know, we learned that when we were kindergartners, right? The ABCs. And now it applies to Medicare when we're getting close to retirement.
Mm-hmm. If you want to put together a customized plan for your employees, or you just want some advice on how to best educate them and help them prepare for healthcare costs and Medicare costs in retirement, we are here to help. If you'd like to apply to become a client of ours, we have a link to do that in the description below. So we'd love to hear from you and help you kind of navigate the confusing parts of Medicare for your employees.
And make sure to watch our next video where we'll discuss the options for employees who work for companies with 20 or more employees.
That's right. And following that, we have another video that is actually a case study on this topic. So hope to see you soon. Please make sure that if you haven't already that you subscribe to our channel, click the notification bell to be notified when we come out with new content, and like our videos.